Hey everyone, I hope everyone are doing great. Myself Dinakar from Sri Venkateswara College of Engineering. I am pursuing my engineering in Computer Science department. Today I am gonna present you a presentation of bone and skin. Layers of skin. First layer is epidermis, the outermost layer that creates a barrier and protects us from the environment. Then dermis, the middle layer that contains hair, follicles, sweat glands, and nerves. Then hypermesh, the innermost layer that consists our glands and regulates body temperature. Moving to the next slide, skin types. Oil skin, shiny skin with clotted pores that require gentle treatments. Then dry skin. Then rough and flaxy skin that requires hydration and moisture. Combination skin. A mixture of oily and dry skin that requires a combination of treatment. Then sensitive skin, prone that lead redness, breakout, and rashes requiring hyperlogen products. These are the types of skin which we have learned now. Now we're gonna learn about functions of skin. Barrier protects us against germs, toxins, and excess water losses. Then sensitine contains nerves that allows us to free touch pressure and temperature. Then thermoregulation controls body temperature through sweating and shivering. Then immunity contains immune cells that triggers infections and diseases. Moving on to the next slide, skin cancer prevention. In this, you're going to learn about sun protection, where sun that hair acts and protective coating under the sun. Body checks your moles and spots regularly for an irregularities of growth. Quick smoking. Smoking is linked to vocalized dry skin and cancer quick as soon as possible. Moving on to next slide. Common skin condition. In that you're going to learn about acne, a chronic skin condition caused by a overactive oil gland that creates pimples. Eczema, a chronic skin condition that leads to itchy red patches usually caused by allergies. Wrinkles, lines and skin caused by ignition, sun damage or dehydration. Psoriasis, a chronic skin condition that creates patches of red, itchy and scary skin. Healthy skin habits. In this, you're gonna learn about hydration. Drink plenty of water to keep the skin hydrated and plump. Exercise. Sweetening cleanses the skin and increase blood flow to keep it healthy. Nutrition. Nowadays, nutrition are more important to the body. Eat nutrition-rich food like fruits, vegetables, and healthy fat to nurture the skin from the inside. Now we're gonna learn about the functions of bone. Support. Bone provides a framework that supports and anchors the body, gives it shape and stability. Then movement. Bones work together with musculars to allow movement and coordination. Blood cell formation. Bone contain bone marrow which produce red and white blood cells and platelets. Protection. Bone protect virtual organs such as the brain, heart, lungs, and spinal cord and injury. In this, you're gonna learn about types of bone in the body. Long bone. These bones are longer than they are wide, such as the femoral tibia and fibula, and provide support and mobility. Short bone. These bones are roughly corbellate, such as the carpals and tarsals, and provide stability and support for the weight bearing. Flat bones. These bones are thin and flat such as the skull and scupule, and provides protection for the internal organs. Then irregular bone. These bones have complete shapes such as vertebral and flexible bone, and provides support and protection. The structure of bone. Permistrum, a density layer of continuity tissues that covers the bone surface and contains the blood vessels and nerves that nourish the bone. Compact bone, a hard, dense layer that forms the outer shell of bone and produce strength and protection. Spongy bone, a less density layer that contains tubules which provide strength and support to the bone. Bone marrow, a soft tissue that fills the hollow inter internet of bone and helps produce blood cells. In this, you're going to learn about bone growth and development. Embryonic development. Bone being as cartilage module, the growth and minimalize over time to form the hard structures of the skeleton. Childhood growth. Once continue to lengthen and strengthen through the teen years until they reach their final size and shape. Adult adult remodeling. Adult remodeling. Uh, bones are constantly being broken down and rebuilt in a process called remodeling, which helps repairing damaging and maintain the strength. In this, you're gonna learn about common bone injury. Fractures, broken bones can result from falls, accidents, and respective stress. Pains, stretching of tearing of ligament can cause pain and swelling. Dislocation. When a bone is forced out of its joint, it causes pain and limited mobility. Strains. Strains or stretching of muscles or tendons can cause pain and weakness. Risk factors for bone disease. Age. Bone masses decreases and the risk of fracture increase after ages 50. Gender. Women has a highest risk of osteoporosis due to hormonal changes. Then family history. Some bone disabled such osteogenesis imperfecta are inherited. Lifestyle factors. Poor nutrition, lack of exercise, smoking, and excessive alcohol or caffeine consumption can increase bone losses. Preventing bone losses. In this, you're gonna learn about bone healthy diet. At a balanced diet rich in calcium, vitamin D, and other nutrition that supports bone health. Exercise. Engage in weight barrier and muscle strengthening activities to pro- promote bone density. Imagine medical condition, treat unusually conditions such as thyroid problems and arthritis that can weaken bones. Preventive falls. Minimize the risk of falling with proper footwear, safety equipment, and home modifications. Thank you. This is what I explained about bone and skin, how it works, what are the diseases, etc. I hope everyone understood. Please do like, share, and subscribe. Thank you.